Let's move on to Roxroy Barrett, CEO, Firm Healthcare System. Roxroy, welcome to the show.
Hey, well, thank you for having me there, Mike. How is it going?
Good, not too bad. Give us a background on who you are, and I just love this first talking statement. Why your hospital sucks at healthcare delivery. We'll save that for just a second. And I'm glad you're fun to because that's serious. But anyway, background on you, and then let's get into the talking points.
Absolutely. Thanks for having me on. Well, just a little brief description of myself. Started in healthcare about 25 years ago, worked in Navy medicine, in some real cool systems all over the world, in different countries and so forth, and decided that, I want to do more really. So joined Mayo Clinic and worked my way from, as a healthcare professional from the front lines all the way up through, leadership positions really. And in essence, I had one goal, and that one goal was to transform or change healthcare. And, we can talk about, what happened there. But in essence, what I discovered at Mayo is that, the healthcare is a transaction between you, Mike, and your provider. And everything else that's around it is what we call support services. So that's a little brief description of myself. And, we're excited because, we're doing real cool, exciting things to change healthcare.
Okay. Your statements are something to the effect of how you can make it more affordable or even free. How does that work?
Well, here's how it works, Mike. If you look at all the big companies out there, such as the Googles, the Amazons, and so forth, these companies are what we call platform. And what we did, while at Mayo is that we, in essence, created more delivery services for outside the hospital. Now, this is kind of counterintuitive to what most healthcare systems do because they get reimbursed for putting patients in beds. That's where they make most of their money. And what we're doing with our platform is we're incentivizing folks to really get care outside the hospital in clinics. And how we do that is we add in technology such as telemedicine, telesecurity, things that can provide the public reassurance that their doctor will be available, I don't want to say 24/7, but in some cases 24/7 to care for them at a cheaper cost outside the hospital. And in doing so, we can add in different revenue services such as, paid advertising and so forth on these platforms.
Is that paid advertising? So paid advertising for the people who are like doctors and lawyers or the people that provide the beds and the medicine?
Well, exactly. So in essence, what happens is as you get healthcare further away from the hospital, you have to find different revenue sources.
Yep.
And so all the support services, such as your pharma, all the things that you can see on a TV ad, you can in essence put in these forms of healthcare delivery. So if you're home, for example, you need to get a knee replacement done, the doctor might send you home with a video to watch. And, just like on different programs, that video might be sponsored by a pharmaceutical company or so forth. And so what that does, it lowers the cost that provider because part of that income that comes in goes to the provider. So we can provide cheaper service, at a much, much, much better effect because it's outside the hospital.
And how's the industry sector taking this? I mean, you've got to have barriers to entry on this.
Exactly. So, a lot of people wonder why doesn't, say, for example, Silicon Valley, and why don't these big companies just jump in and do what they've done for manufacturing and so forth in healthcare? Well, it's what's called the bureaucracy of government, and in a good sense, because you want to make sure that your doctor didn't just go to, South America or wherever and get a medical degree. You want to make sure that your doctor is, is well, trained and so forth. And so you can't practice medicine. Watson from IBM they can diagnose you based on your symptoms, but they can't treat you unless you're a doctor. And so we realize that. And so what we're doing, we're involving the doctor. There's 60,000 providers that are out there that are looking to really, become part of something bigger, but outside the hospital.
Hi, Roxroy. This is Ed Baxter of Bison Creek Capital. You mentioned something interesting a second ago, and you can obviously address this after the break here too. But What is a company like Stryker's incentive to support and or I guess sponsor a knee replacement video for someone sitting at home looking to make a knee replacement going forward?
So I mean, as far as incentive for them to do it.
Yeah, what would be an orthopedic company's incentive to actually support that?
Well, if you think about it for a second, Stryker or any pharmaceutical company, Stryker being a producer of different implants and so forth, and a pharmaceutical company who produce pharmaceuticals, they have a bunch of reps that go out there, and what they try to do is convince the doctors and the hospitals and outpatient services to use their particular implants. So there's no difference there from going, using these reps or for showing patients that, look, using these implants or these medications will allow you to recover faster and better. And so that's the incentive for them to really, in essence, use our platform to deliver, ads to the patient population.
We're going to need to take a break. So, Roxroy, give me a second, and we'll come back and continue with the conversation on the other side, all right?
Certainly. Thank you.
You're welcome. Roxroy Barrett, CEO, Firm Healthcare Systems, and the segment brought to you by thevitaminpatch.com. We'll be right back on the other side of this break. Welcome back to CEO Money and Michael Yorba, your host. Roxroy Barrett, CEO, Firm Healthcare Systems, on the show with us today. All right, Roxroy, we were having a real roundabout conversation here on the break about all of the, the middlemen that are inside the medical industry, why expenses are so high. And, Ed was bringing up a couple of points. Ed, jump in the conversation here now with Roxroy.
Well, I think part of what you're doing it actually kind of addresses this, but one of the things that we talked about in the break was the competition or lack of competition in healthcare in general, and how we keep adding layers to a system as bureaucratic as you mentioned before. So obviously that's something that's an issue for you, and you also indicate that people will have to change or these systems will be disruptive. What do you see future-wise as far as the current systems and how they'll be disrupted with technology and with platforms like yours?
Yeah.
Absolutely. In essence, I think you're right on there, Ed. I think that, the healthcare system has been resistant to change because they've seen what has happened with technology in a few different industries. And they have a lot of barriers to entry in that you cannot, as the technology company, you can't, in essence, diagnose and treat a patient without a physician. So here's what's coming down the pipeline for a lot of these systems. You have, IBM doing Watson. You have Google, doing their own thing. Amazon doing their own, AI. There's a lot of technologies that are, in essence, telemedicine technologies that can, in essence, treat a lot of these patients outside the hospital. Because what we're saying is that we're betting that most people don't want care inside the hospital. They want to be home, and if they feel sick in the morning, they want to pick up their phone, use their telemedicine app, and call their provider and talk to them. And we see, in essence, the key to making this happen is roughly 60,000 physician practices that are independently owned. These guys have no affiliation with any hospitals, and they're looking to partner with companies like us who are going to leverage by a majority ownership in these companies and, in essence, create value for our shareholders, one, and two, for the public. That's kind of what's coming down the line.
I have a naive question because this is really not my field of expertise, what we're talking about. But how does this fit in with all the insurance companies being able to subsidize the cost to, the patient? How does that work?
It fits, that's a very good question. So in essence, what a lot of people don't realize is that insurance companies have a lot of investment arms that are looking for ways to drive cost out of care. And the trouble that they face is that providers are oftentimes resistant. And, again, I don't want to knock anyone here, but, since I have nothing to sell, I can tell you straight up what's happening here. And so, providers are resistant because, in essence, they need somebody doing the billing. They need someone doing, the nurse there. They need all these, what we call support services. And they're slow to adopt technology to drive these things out. So what the insurance companies are doing, which is really cool, I mean, it has taken a step back recently, but what they've been doing what's called pay for performance. And in essence, if you pay to get your knee replacement done and you went to a hospital and you got an infection, insurance companies are saying, look, I'm not going to pay for that infection. Or they're saying, we're going to pay you one set amount for all knee replacement surgeries. So doctors who can drive out costs, who can adopt technology, who can have their overhead being less, those doctors are going to basically be, reimbursed by these insurance companies a lot more, relatively speaking, if you think about it. If you have less costs, you're going to get more of the pie than if you have, a huge overhead.
It seems to me, and again, I'm not an expert in the medical service industry, but the concierge doctors are really the way to go with this, because they're the ones that are going to be okay.
Absolutely. I mean, everything you can think of right now. I mean, there's literally. I mean, last time I was out in California for J.P. Morgan conference just last week, and there's a lot of companies, Ed and Mike. There's a lot of companies out there that are on the sideline right now, developing technology, doing a lot of things that are going to be very disruptive, and they're all looking for a platform, a way to get into the industry. And so, in essence, we see a lot of insurance companies, a lot of private equity groups that are looking at us and saying, listen, we want to be a part of the big picture here because we see the future of healthcare not in beds. If you look around, Texas, we work with companies in Texas and so forth, and a lot of these big hospitals are struggling because most people, the baby boomers, they don't want to go to a hospital.
Yep.
They want care outside the hospital.
Right, I get it. We got about a minute left before we need to change track and move on to our next guest in the show. But are you growing the company purely organically, or are you taking on investors to grow it in that fashion? For those people looking for a place to put their money, does this fit with you, or just?
Well, we're very, very picky. We're very, very picky. We say no to a lot of people because we try to get good qualified investors. Currently, we're working with high net worth individuals and family offices. But it's a good fit for people who want to transform healthcare, who want to basically look at a system like in Texas and say, look, I want to invest in my local family practice. So yes, to answer your question, yes, we're working with external growth, so we're looking to do roll-ups of other smaller practices around, so we can in essence have strength in numbers. That's what we're looking to do.
Got it. We've got to run, but I've got somebody I want to introduce you to. I'll make sure and reach out to you after the show.
Absolutely. Thank you.
Thanks, Roxroy Barrett, CEO, Firm Healthcare Systems.